Adaptive equipment, the long-handled comb. Adaptive equipment allows patients with injury or disability to gain independence in their activities of daily living. These modifications and adaptations allow individuals to achieve their therapeutic goals and improve their quality of life. This presentation focuses on the long-handled comb, a piece of adaptive equipment used for personal hygiene and grooming activities. The objectives for this video are for the listener to learn what patients might need a long-handled comb, to understand factors that affect the ability to obtain a long-handled comb, and to apply the knowledge to help patients in their activities of daily living. Patients who experience a limited range of motion or decreased strength in their upper extremity may benefit from the use of a long-handled comb. Shoulder, arm, forearm, wrist, or hand disability could make it difficult for the individual to properly comb or brush all parts of their hair. Some diagnoses or situations that could result in the need for a long-handled comb include shoulder surgery, difficulty lifting arms, limited shoulder mobility, arthritis of the shoulder, broken arm, rheumatoid arthritis, or injury or difficulty after a stroke. If you have a patient with limited range of motion, decreased strength, or difficulty bringing hand to head, they may benefit from the use of a long-handled comb as a part of their occupational therapy plan. As a therapist, you can help a patient by providing information about purchasing a long-handled comb. The simplest way to complete the purchase is by the patient or caregiver with internet access going online to buy through a retailer such as Amazon or an arthritis-specific or medical supply store. The prices range from around $12 to $20 depending on the options selected and on the seller. Some options include different lengths, the strength of the brush or the comb, and the type of handle or grip. The purchase can be delivered to the home of the patient and is ready for use right out of the box. Many patients will find this purchase to be a simple and worthwhile addition to their therapy program. Once the comb is purchased, it's important that the patient learns how to properly use the comb and is comfortable incorporating it into their grooming habits. The therapist's application of their knowledge of the patient goals and limitations, along with the function of the comb, is key to successful adoption of the product. Here is some more information about the long-handled comb.
This is one example of a long-handled comb. With the many options and features available, it is likely that you'll be able to find a long-handled comb or brush that is comparable to what your patient is used to using pre-injury. On this model, you can see that the comb is attached in a way that it can be adjusted to many different angles. Some clients may find this very desirable to give them freedom over how they style and brush their hair. On this model, the handle is straight and inflexible, and the grip has finger holds to give the client a more secure grasp on the long-handled brush. Other models feature different styles of brushes with harder or softer teeth, perhaps a brush head with a more traditional look to it, and handles that have different variations of curvature, as well as grips, some with a circle through the middle for the patient to grasp more fully. This brush measures 14 inches plus the length of the comb. As you can see, this would be ideal for a patient with a shoulder or neck injury to be able to brush their hair without aggravating that injury and causing pain. Now, let's see it in action.
Amelia is a patient with severe arthritis of the shoulder, and lifting her arm for grooming activities such as brushing her hair caused extreme pain and discomfort. With a long-handled comb, Amelia is able to independently complete her daily hair grooming and reach even the back of her hair. Before purchasing the comb, Amelia and her OT discussed her preferences and habits related to grooming. This was an important step to help determine the features that would best suit Amelia and increase the likelihood of consistent successful use. Amelia's therapist can continue to monitor the use of the long-handled comb and address any complications or frustrations that may arise. Remember, the occupational therapist plays an important role in the successful adoption of the long-handled comb. As discussed in this video for the long-handled comb, there are several steps that can ensure the successful use of adaptive equipment. The therapist must first learn about both the equipment and the disability of their client. They must also understand how these two factors will interact with each other and any barriers that may affect the use of the equipment. Finally, the therapist can apply these factors to their client to help them successfully reach their goals.